Is there a best age to get a rhinoplasty or a nose job? What age should you get it at? Can you be too young for a nose job? Can you be too old for a nose job? We're going to talk about all those things today. I'm Dr. Peter Vila and I'm a facial plastic surgeon. So in this video, I'd like to start talking about age and what the best age is for a nose job. So in terms of talking about the best age to get your nose done, there's definitely a minimum age. So for young, usually girls, sometimes guys, that just don't like the shape of their nose and they want to do it maybe before they go off to college, that's a great time to do it because you're going to have that shift where you're going to be leaving the friends that you're seeing all the time in high school and going to a new friend group, new social circle. So that generally is a good transition point, but really what it comes down to is the age at which your nose stops growing. We have to talk a little bit about the anatomy of the nose, and that is basically due to the growth of the septum, the septal cartilage. That's that cartilage in your nose that gives it that shape, and it goes all the way back. And that septum is what causes your nose to grow off of your face. It gives it the projection off of your face. So if you do a nose job or rhinoplasty on a patient that is too young and the nose has not stopped growing, you're effectively going to interfere with the growth of the septum, and that's going to leave you with a short nose as an adult. Now, in some people that's not as big of a deal. In general, women tend to like smaller noses, but there is such a thing as looking too small, and if it looks too small, it just won't look right, and that's a difficult problem to correct. So in most patients, the rule of thumb is about age 16 for where really anyone under the age of 16 should not be having a cosmetic rhinoplasty. There are other reasons to have nasal surgery if you're younger. You have trouble breathing through your nose, if you were in a trauma where you broke your nose, all of those are valid reasons to have surgery. But if it's for a cosmetic reason where it's really just you don't like the shape, that should really not be done in anyone younger than 16 years old. In a girl and in a guy, it's going to be roughly the same, but you can tend to wait a little bit longer because guys tend to finish growing at a later age than girls. So for guys, 17 or 18, it really depends on their body. And if it looks like they're full grown and they've got their full grown anatomy, you can err on the slightly lower side. But in general, you're really going to want to wait until you're full grown so that there's no issues with restricting the growth of your nose. Now, on the older side, if you decided, is there an age where you're too old to have a rhinoplasty or a nose job? Not necessarily. And what that comes down to is that if there's changes that you'd like to make to your nose, you have to know that this is going to change your facial profile. This is going to change the way people see you. And so if you've looked a certain way your whole life, and then at age 50, you're all of a sudden going to change that, you know, a subtle change is fine. Maybe it's just a little bit crooked and you want to straighten it out, or maybe the tip's getting a little droopy and you'd like to bring it up and make it a little more perky. Those are all valid reasons, but you have to understand that people have seen you a certain way for years, and they're not necessarily going to know that something was done, but they'll be able to identify that you look a little bit different. And maybe you're okay with that, and that's not a big deal, but that's something you should know up front, is that if you do decide to make a major change to your nose later on in life, that is something that other people are going to notice. Now, usually making changes to the nose makes it less noticeable, not more noticeable. So people may not be able to identify exactly what it is about you that's different, but they may notice that something's different. The other thing to know in older patients who are getting a rhinoplasty is that the skin does not stretch back as much as it did when you were in your 20s. So for example, if you have a big bump on your nose and you want to get rid of that bump later in life, all that skin has to go somewhere. And so it can be a little bit of a challenge if you're taking a really big bump because that's a lot of excess skin. You can think about it as basically that sheet on your nose has been stretched out. And in younger patients, that kind of stretches right back. If you think about when you have a baby and that skin over your belly just stretches right back in a younger girl. As you get older and older, it tends not to stretch back as much. And what does that mean? That means in the nose that if you have a big bump, and you're going to reduce the size of it, that skin may be kind of pooched up there for a little while, and it may take a lot longer for it to get nice and shrunk back down onto the nose the way we want it to be. And eventually it does happen, but it can take a long time in an older patient. So that's something else to think about. If you're making subtle changes, that's probably not a big deal, but it is something to know, and that's something to bring up with your surgeon to just ask. One of the other questions that often gets brought up is, how long will my nose job last? Is this something I'm gonna have to have a second surgery for in the future? The answer is this should last forever. When we make changes to the nose, I do certain things in a rhinoplasty that ensure that the nose is locked in and stays that way for the rest of your life. You should not need another surgery to change things or change the appearance, because in my mind, that's just a failure from the first surgery if you need a second surgery to correct something. We do a lot of things in the nose now that we didn't necessarily do 20, 30 years ago, but we've learned a lot more about how noses continue to change after a rhinoplasty, and there's certain things that if you don't do 10 years, 20 years down the road, you will notice certain changes. Like, for example, your nostrils may be a lot more flared if you don't take steps to address that at the first surgery. So it should last forever. And one of the best things about a rhinoplasty is that the skin does shrink wrap back down. So if you've made the nose smaller and that extra skin is bunched up, over time that will sort of shrink wrap back down over the nose and over the cartilages. And that's good. That's usually what people want. Usually at about a year is when it's really, really set after surgery, but the nose will continue to have tiny, tiny changes over 10 years, 20 years if you don't take those steps. And that's why it's really important to make sure you go to a surgeon who is doing those things to prevent the nose from changing further and to give you good stability so that your breathing is not impacted by your surgery as well. Then in a related question, will my nose job age well? If you're a younger patient and you're thinking about getting your nose done, how is that going to look when you're in your 50s and 60s? And what it comes down to is that the way our noses age, in general, it has to do with the skin. And what people usually notice is that the skin gets thinner over time. So you may start to see parts of your nasal anatomy that you didn't know were there before. When you were in your 20s, that's not something you necessarily noticed. When you're in your 30s and 40s, and all of a sudden you start to see every little cartilage in your nose, every little line that wasn't there 10 years ago. And that's because the skin is thinning out a little bit and the SMAS layer underneath is thinning out a little bit. That's just a muscle and connective tissue layer under the skin. And so as we get older, that can also get a little bit stretched out. And so the nose can start to look a little droopy the way that it didn't maybe when you were younger. So as you age, that will certainly be an issue. And some people it's much worse than others. But sometimes the tip can start to get a little bit more droopy, and that's really just due to the fact that the skin is stretching out. In my opinion, if you have a rhinoplasty, let's say when you're age 20, that should stick with you for the rest of your life, and you should not need another surgery to do it. When you talk about things like a facelift, for example, that's something where you may need touch-ups because the skin you can only do so much the first time you're there. And then if people really want to have zero skin under their neck, for example, then that's something you may need another touch-up 10 years after your first facelift. The rhinoplasty is not like that. It should really just be a one-and-done procedure where we're going to set you up for success the first time out of the gate, and you shouldn't need another surgery on your nose. Thanks for checking out this video. If you thought the content was good and you're learning from it and you enjoy it, go ahead and like the video. If you'd like to learn more about rhinoplasty and facial plastic surgery, go ahead and subscribe to my YouTube channel, or you can follow me on Instagram so that you don't miss any of this awesome content. Thanks guys, and I'll see you on the next video.